Greetings, everyone. Today, I'm excited to talk about a crucial topic in the field of medicine, heart bypass surgery. It's a remarkable procedure where skilled surgeons reroute pathways in the heart to improve its function and restore health. This surgery holds the power to bring renewed life and hope to those who need it most. So, let's explore this captivating world of modern medicine together and understand how this intricate procedure can make a profound difference in people's lives. So first we need to tackle on what is heart bypass surgery. Heart bypass surgery, also called coronary artery bypass grafting, CABG, is a surgery that helps improve blood flow to the heart. It's done when the blood vessels that supply the heart become blocked or narrow. During the surgery, a doctor takes a healthy blood vessel from another part of the body, like the leg or chest, and uses it to create a detour around the blocked or narrow arteries. This new pathway allows blood to flow more freely to the heart, relieving symptoms like chest pain and helping the heart work better. Heart bypass surgery is a common procedure that has helped many people with heart problems feel better and reduce the risk of complications. Before dwelling more on this procedure, we shall discuss an overview of the topics that we are going to tackle. The topics are: procedure overview, benefits and outcomes, signs and symptoms you might need surgery, risk and complications, prevention, risk factors, recovery and rehabilitation, and cost of operations. Procedure overview of this procedure. For anesthesia, at the beginning of the heart bypass surgery, the patient is administered general anesthesia. This ensures that they are unconscious and won't feel any pain or discomfort during the procedure. Anesthesia is carefully managed throughout the surgery by an experienced anesthesia team. For incision, once the patient is under anesthesia, the surgeon makes an incision in the chest to gain access to the heart. The most common approach is a sternotomy, where the breastbone sternum is carefully divided to create a large opening. In some cases, minimally invasive techniques might be used, where smaller incisions are made on the side of the chest. For heart-lung bypass, cardiopulmonary bypass, to perform the surgery, the heart needs to be still and bloodless. To achieve this, a heart-lung bypass machine is utilized. The machine temporarily takes over the function of the heart and lungs, oxygenating the blood and pumping it throughout the body while the surgeon operates on the heart. For graft placement, the primary goal of heart bypass surgery is to bypass or reroute blood flow around narrowed or blocked coronary arteries. To do this, the surgeon harvests healthy blood vessels, known as grafts, from other parts of the body. The most commonly used grafts are the internal mammary artery from the chest wall and segments of the saphenous vein from the leg. These grafts are carefully prepared and then attached to the aorta, the main artery leaving the heart, on one end, and the coronary artery beyond the blockage on the other end. This creates new pathways for blood to flow, effectively bypassing the obstructed areas. For completion, once all the necessary grafts are placed and blood flow is re-established, the surgeon ensures that they are functioning correctly and that there are no leaks or complications. For incision closure, after the bypass procedure is completed, the surgeon carefully closes the chest incision using either sutures or staples. The incision closure is performed meticulously to promote optimal healing and reduce the risk of infection. For recovery monitoring, following the surgery, the patient is transferred to the intensive care unit ICU for close monitoring and care. Specialized medical staff closely monitor vital signs, heart function, and overall recovery progress. The patient's condition is continuously assessed, and any necessary interventions are promptly provided. For post-operative care, after the initial recovery period in the ICU, the patient is moved to a regular hospital room. During this phase, they receive comprehensive post-operative care, including pain management, medication administration, wound care, and physical therapy. The medical team ensures that the patient is stable and gradually improves before considering discharge. It's essential to remember that heart bypass surgery is a complex and delicate procedure, and the specifics may vary based on the individual patient's condition and the surgeon's approach. Patients are advised to follow their healthcare provider's instructions carefully and attend regular follow-up appointments to ensure a successful recovery. For the benefits and outcomes, it would improve blood, relieve chest pain, enhance heart function, improve quality of life, and reduce risk of complications. In this procedure, the common signs of symptoms we usually see for a person to see a physician for a possibility to need to this procedure are the following. If the patient has severe coronary artery disease, if the patient has a blocked or narrowed blood vessels, if the patient has chest pain, and if the patient is experiencing a heart attack. Having this procedure, it is expected that a patient would experience some post-operative symptoms. In this procedure, a patient would be at risk of the following complications: infection, bleeding, reaction to anesthesia, blood clots, stroke, irregular heartbeat, and wound and complications. It is in our best interest to also know how to prevent this matter from ever happening or for us to have this procedure. In this slide, we should know the things we need to do in order for us to prevent forever needing this procedure. First is we need to have a healthy lifestyle. Eat balanced and nutritious meals and exercise regularly and avoid smoking alcohol. Second, we need to manage our risk factors, in the sense on controlling our blood pressure, cholesterol, diabetes, and maintain a healthy weight. Third, we need to manage or have regular checkups, monitor our blood pressure, cholesterol and heart health. Fourth, stress management. We should practice or have a technique to reduce our stressors. And last is medication adherence. It is important we should take the medication that are prescribed to us as directed. In these preventions it would help us avoid this procedure. Now for risk factors for this procedure. It is important we know the risk factors for this procedure, as what is discussed on the topic of prevention. It would help us be aware of the high possibility of us needing this procedure in the near future, and give us ample of time to prepare or to do interventions reducing the odds for us to acquire this procedure. So the risk factors are the following. If the person is an older individual, if the person smokes, if the person has chronic high blood pressure, if the person has high cholesterol, if the person is diabetic, if the person is obese, and if the person has a family history of the discussed risk factors. Now for rehabilitation. It is important for us to know the recovery and rehabilitation of this procedure, for us to endure a smooth and successful outcome. Here are the key aspects. It is important that we are hospitalized until our physician would say otherwise. This is to ensure that if anything happens, the patient would be taken care of as early as possible. It is important that the patient takes the medications prescribed by the doctor. It is important to have post-operative care. Other aspects includes cardiac rehabilitation, gradual return of activities, and follow-up appointments. Now for the important part. I say everyone is interested to know, how much does this operation usually cost? So the cost of heart bypass surgery vary depending on the hospital of the patient being admitted. But to give you a rough estimation, the cost of this surgery ranges from 650,000 pesos to as high as 1.6 million pesos. Expensive, right? That is why it is important for us to know on the preventative measure we should take if we don't want to be in debt because of it. Now that concludes my presentation on this procedure. I hope you have learned a lot and I wish you could like, comment, and subscribe to this channel to see more content like this. That's all for today. See you next time. Peace.